Hello, everyone. A very good afternoon to my viewers. I'm Dr. Seema Sahay, practicing as a obstetrician and gynecologist in Patna. Today, I'm going to uh, discuss with you or make you know about the pain abdomen during pregnancy. And not only pain abdomen, but acute pain abdomen, which sometimes happens to the patients during pregnancy. Uh, Acute pain abdomen, though not very common, but still it is a very common symptoms happening to the patients. And there are so many things which we should know about acute pain abdomen. The acute pain which happens during pregnancy, first now we should understand what is pain abdomen, why pain abdomen during pregnancy. So there are two types of pain which occurs during pregnancy. One is normal physiological pain, which every woman experiences, and some women, due to some regions, they expect they feel acute abdominal pain during pregnancy. So first, we must differentiate between the normal physiological pain and pathological pain. मैं ये बताना चाहती हूँ कि कुछ पेन ऐसे हैं जो बिल्कुल नॉर्मल हैं प्रेगनेंसी में, जो ऑफ एंड ऑन इनफ्रिक्वेंटली होते रहते हैं, लेकिन कभी कभी जो पेन होता है उसके पीछे कोई ना कोई वजह होती है. सो हम लोगों को वी मस्ट डिफरेंशिएट. तो जो पेन होते हैं वो पेन अर्ली प्रेगनेंसी में भी होते हैं, लेट प्रेगनेंसीज में भी होते हैं. पेन जो है वो दो तरह के हो सकते हैं. वन विच इज रिलेटेड विद द प्रेगनेंसी एंड cause lying in the pregnancy, which we call obstetrics causes, और कुछ पेन ऐसे होते हैं जिनका प्रेगनेंसी से नहीं, बट इट इज ड्यू टू सम medical or surgical illness. So the pain must be differentiated. It is very important. If we do not diagnose the situation properly and do not manage the patient properly, it may lead to severe fatal consequences sometimes, or not even fatal, then serious complications. So acute pain abdomen during pregnancy should not be ignored, must be this. Why pain happens during pregnancy? So first we should know about the physiological physiological pain, which is a normal pain. तो नॉर्मल पेन जो प्रेगनेंसी का होता है वो बिकॉज ऑफ एनलार्जिंग साइज ऑफ द एब्डोमेन, आप यूट्रस का एनलार्जिंग साइज के चलते पेन होता, दैट इज अ नॉर्मल पेन. उस पेन को हम लोग फील नहीं करते, प्रेग्नेंट पेशेंट्स फील नहीं करती. दे आर नॉट स्पाज्मोटिक, दे डज नॉट, the pain does not affect the health of the patient as well as the fetus both. And this is just because of infrequent contraction and relaxation of the uterus, which patient does not feel. And this is called physiological. And sometimes because of stretching of the organs, stretching of the abdomen, stretching of the uterine ligaments, there are so many causes when the which causes pain, but it is harmless. It is a normal thing. But there are some causes which which causes acute pain during pregnancy, which we differentiate as a medical cause, surgical cause, and causes related with the pregnancy. And acute abdomen can happen in early pregnancy also and in late pregnancy also. In early pregnancy, if a patient feels acute pain abdomen, we must think about two things very important. First, she may be aborting. Abortion gives very acute pain abdomen. Second, ectopic pregnancy. Ectopic pregnancy, let me explain. When the pregnancy is not in the uterus, but it is in the tube, which is a very common site other than uterus. So ectopic pregnancy also leads to acute abdominal pain during early pregnancy, and it is a life-threatening situation. So acute pain abdomen must not be ignored. And as I told you, first important cause is abortion. Now, there are other causes also, like if a patient is having urinary tract infection, then she can have acute pain. If these are the surgical or medical causes, like she can have acute appendicitis during pregnancy, she can have cholecystitis, गॉल ब्लैडर का पेन हो सकता है, जो गॉल ब्लैडर में गॉल स्टोन होता है, that also gives rise to acute pain abdomen. Then bladder infection, as I told you, that can be renal colic also due to stone in the kidney, stone in the ureter. These are the surgical causes. Sometimes peptic ulcer syndrome. Some patients have very severe gastritis because of vomiting, poor appetite, altered appetite. So patient may experiences nausea, vomiting, severe gastritis, which leads to acute pain abdomen. So these are the some medical and surgical causes, like overstretching of the abdomen is also one of the important factors, as for example in twin pregnancy, or when the amount of liquor, जो पेट के अंदर का पानी होता है, थैली में जो पानी होता है, वो अगर एक्सेसिव हो, अनड्यू एनलार्जमेंट हो एब्डोमेन का, तो ये सब कॉजेज भी जो होते हैं वो कभी कभी पेन एब्डोमेन का कारण बन जाते हैं. डिस्पेप्सिया फ्लैचुलेंस जैसा मैंने बताया, और अदर सर्जिकल कॉजेज ऑल्सो. उसके बाद कभी कभी एक्यूट लीवर में इंफेक्शन, बिकॉज लीवर जो होता है दैट्स अ वेरी इंपॉर्टेंट ऑर्गन, और इस पे लोड पड़ने के कारण ड्यूरिंग प्रेगनेंसी समटाइम्स पेशेंट develops acute fatty liver. This also leads to say acute pain during pregnancy, and there are or other important causes also, like if rupture of the cyst. Suppose patient is having ovarian cyst, it may rupture, या कोई उसका पहले से मास हो जो अनडायग्नोज्ड रह गया हो, उसमें किसी तरह का कोई चेंजेस आ जाए, जैसे ओवेरियन मास है तो उसमें हैमरेज हो जाए, टॉर्शन हो जाए. दीज आर द वेरी इंपॉर्टेंट थिंग्स विच कैन हैपन ड्यूरिंग प्रेगनेंसी. या प्रेग्नेंट वेमेन को पहले से फाइब्रॉइड हो यूट्रस में, she might not be knowing, maybe undiagnosed, तो उस फाइब्रॉइड में कभी कभी एनलार्जमेंट, डिजेनरेशन वगैरह प्रेगनेंसी में बहुत कॉमन होते हैं. दैट ऑल्सो गिव्स राइज टू पेन. और जैसा मैंने बताया कि एडेनेक्सल मास मीन्स ओवरी ट्यूब वगैरह के पास कोई मास डेवलप कर गया हो, उसमें किसी तरह का इन्फेक्शन हो जाए, टॉर्शन हो जाए, हेमरेज हो जाए. सो दीज ऑल थिंग्स आर very important causes for acute pain abdomen during pregnancy. And second factor is that whenever the patient comes to a doctor for for acute pain abdomen, she must be there investigated thoroughly and properly. Lab investigations are also important, and ultrasonography is invaluable. That must be done immediately, and we can diagnose so many causes by even simple by doing an ultrasonography. And sometimes we need CAT scanning also, CT scan also. But though it's a rare, and MRI is safe during pregnancy. We do not give radiation exposure. Radiation exposure is not allowed during pregnancy. So X-ray is not done, but we can come to conclusion by simply lab investigation, thorough examination of the patient, knowing her symptoms, examining her lab investigations, and ultrasonography. This can lead to the diagnosis, and management is also very important. Urgent management patient needs for acute pain abdomen. Otherwise, acute pain abdomen during pregnancy can lead to serious consequences. These things I wanted to make you know that importance of acute pain abdomen is very important. Now, audience, we can go for question answer session. You can ask me whatever queries you have, and if you want to know, the first question is asked by Jenny. What can I do for instant pain relief? It's very important that pain must be relieved instantly. So the first thing, you just take rest, lie down, and you need some analgesic immediately. Sometimes you just lying down and taking rest. If it is a physiological pain, normal pain of pregnancy, it will subside by simple taking rest, and you try and relaxing and all that. But if it is not physiological pain, I mean normal pain of pregnancy, then definitely you must take analgesic, and then you consult your doctor immediately. Why did I have this type of pain? Second question is asked by Divya Patil. What are some bad signs during pregnancy? Bad signs during pregnancy, which you are asking, I'm answering it related with pain abdomen. If the patient experiences acute pain abdomen and it is associated with severe vomiting, uh, fainting attacks, giddiness, patient collapses, or she has excruciating, agonizing pain, then this type of pain is not physiological. What are the associated attacks, collapse, severe vomiting? Not patient is having acute agonizing pain and severe cramps. These all are not a good sign and not a normal thing of pregnancy. Third question is also asked by Divya Patil. Uh, is it normal to have sharp stabbing pains during pregnancy? Normally, sharp stabbing pain during pregnancy doesn't happen. But this is also depends upon your perceivement, how the patient feels pain. Sometimes the pain of acute peptic ulcers, peptic ulcer feels like a stabbing pain, but it's not a normal. It's not a normal. Normally the pain is not much. You can bear it. Next question is also asked by Divya Patil. When should I go to the hospital for abdominal pain during pregnancy? Remember one thing, pain during pregnancy, if it happens during early stage, it may lead to abortion, and if it is in the late 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 trimester or late stage, you must not forget that patient may go into early labor or preterm labor. So first, when you feel that pain is increasing in intensity as well as duration, as well as frequency, and if there is discharge also per vaginum, or if the pain is becoming severe, acute, agonizing, you are having giddiness, you are having fainting attack, then you must go to the hospital immediately. or when your pain is mild to moderate and it is not simply relieved by taking rest or analgesic or uterine relaxant, then also you should go to the hospital. Associated symptoms are also very important, like giddiness, vomiting, bleeding, fainting attacks, collapse. These are the very important symptoms. Uh, Next question is asked by Kavita Shahane. When should I be worried about cramps during pregnancy? Listen, mild cramps in abdomen during pregnancy is a normal thing. Sometimes it happens due to infrequent non-spasmodic contraction of the uterus. Uterus has got a nature. Throughout the pregnancy, it contracts and relaxes, but in a very mild way, infrequently, and doesn't affect the health of the women, or it does not dilate cervix or like that. But when cramps increases, it disturbs your sleep, it disturbs your activities. It is not relieved by simple analgesics and uterine relaxants, and you are not comfortable with it and increasing, then you should be worried that these cramps are not physiological, not natural. Next question is asked by Jenny. Had any particular exercise to be done? Antenatal exercises are becoming part of the antenatal care. So antenatal exercises under guidance of a doctor or a expert physiotherapist who knows antenatal exercises, it should be done. But there's no exercise which will regarding pain abdomen and it will not cause pain and like that. But simple antenatal exercises you should do, but under guidance. Next question is asked by Lakshmi Mishra. What are normal pregnancy pains? As I told you, the normal pregnancy pains are which are which are infrequent and patient does not feel it, her activities are not disturbed, and it is due to regular contraction and relaxation of the uterus, which is very infrequent and uh, very less in intensity, and patient can bear it comfortably. And it is known as Braxton Hicks contraction. The name is given in the name of scientist who discovered this clinical entity. And later on, as the pregnancy advances, the frequency increases, intensity increases, duration becomes less, and it changes into gradually labor pain. So these normal pregnancy pains are bearable. This is very important question asked by Lakshmi Mishra. How do I know it's a labor pain? Because every pregnant woman must know that she is going to have labor pain. Labor pain, the characteristic of labor pain, that it increases in frequency, and duration, and gradually the time interval becomes less. Suppose if you feel one contraction in 10 minutes, then as it advances, you will feel that contraction is increasing in intensity and it does not subside by simple analgesic. Then next thing, you will feel that you may feel, it's not necessary, you may feel there is some discharge per vagina, which may be blood mixed, which may be watery, like that. And blood mixed discharge associated with pain abdomen is a sign of labor pain, which we call show, SHOW, show. Blood mixed mucoid discharge, and with abdomen increasing abdominal pain, then you must consult your doctor. Next question is also asked by Lakshmi Mishra. Which side of the stomach does the baby stay? The side is not fixed. Baby moves in the abdomen, and it gets fixed in a first pregnancy, usually 3 weeks before the expected date, and in a gradual when subsequent pregnancy during labor pain. Baby moves. It does not stay in a particular position, but the normal position of a baby is left side, left side, which we call LOA, left occiput anterior. Normal position is LOA, but baby moves. Next question is, by which fruit should I avoid during pregnancy? Listen, one thing is very important. Whatever you can digest and which does not affect your health is suitable for you. So every fruit is important. It doesn't mean that this fruit you should take, this fruit you should not take. Fruits contains lot of micronutrients. So it all depends that it doesn't affect your health. And you can take any fruit. Next. Next question is asked by Bhavna. How long do cramps last in pregnancy? Cramps doesn't last long, just for few seconds or few seconds, or hardly 1 minute to 2 minutes. The normal cramps of pregnancy doesn't last much. Uh, One question is it normal having abdominal pain while pregnant? As I told you before, that mild, infrequent pain is very common during pregnancy. Uh, it does not affect anything. Patient just comes and go, and patient can bear it very normally, very comfortably. So mild abdominal pain pain is common during pregnancy. Next question is by Devya Patil. What is considered severe abdominal pain in pregnancy? I think I have explained this, that when the pain becomes uh, severe in intensity, I mean acute, patient is not able to bear the pain, and it is a spasmodic, and patient faints, or she starts vomiting, she develops rapid pulse, and she may collapse. These types of pain are severe abdominal pain in pregnancy. It's like your biliary colic, I mean gallstone pain, renal stone pain, acute cystitis, I mean bladder infections. This gives rise to severe abdominal pain during pregnancy. Otherwise, acute appendicitis, severe spasmodic pain, gradually rising in intensity, duration, frequency, every. and associated with some symptoms also. Yes, yes. I'll answer every question. Uh, one question is Revati Rajmani. What is considered as severe abdominal pain during pregnancy? I just explained. What is severe pain? When you cannot bear any pain and it is acute agonizing, it is severe pain. Uh, Question by Sonam Patel. Is it normal to have stabbing pain during pregnancy? No. Unless until there is some pathology there, why should you experience a stabbing pain during pregnancy? I don't think so. What are some bad signs during pregnancy? Asked by Durga Salvi. This also I have explained that bad signs of pregnancy, bad signs during pregnancy are, first of all, which is the topic of the today, acute abdominal pain associated with so many symptoms, vaginal bleeding, vaginal discharge, uh, and vomiting. And there are so many things, vasovagal collapse, which we know as fainting attacks, circulatory collapse. If you have ectopic pregnancy, these are the very bad signs of pregnancy. Is it normal to have abdominal pain? Asked by Rebecca Prakash. Yes, the normally patient feels pain, which I explained as Braxton Hicks contraction, stretching of the ligaments, stretching of the organs, stretching of the abdomen, uh, and these excess liquor. So these are the normal causes for and which gives rise to mild pain, abdominal pain during pregnancy. Mm. So, audience, uh, I think you must have known with acute abdominal pain during pregnancy and how important it is. You must consult your doctor as soon as you feel that pain is not bearable by me. It is not a normal pain which you experience often. So this symptom should not be neglected, but must be investigated, and must thorough examination of the patient is also very important. And we much reach to conclusion very soon, and the management is also very important. It is not managed at home. You must go to hospital and your doctor will take care of you. And viewers, I must tell you that my referral code is SEES, SEES, capital S, capital E, and again S. So, uh, I'm very hopeful कि आप लोगों को ये अच्छा लगा होगा और आप बेनिफिटेड जरूर हुए होंगे. If you can ask any question, I have given you my referral code and I'm always available for you to answer your queries, your question, and whatever possible, I will give you the depths of management also. Thank you.